Some increased risk factors for preeclampsia would be it being your first pregnancy. Age plays a role, so being 35 or older or being very young, a teenager. Diabetes, obesity, chronic hypertension, genetics plays a role, as well as family history. Many women don't even realize that their blood pressure has begun to rise, so going to those prenatal visits is really important. If your doctor has said, hey, your blood pressure is starting to increase, that is something where they may have you continue to monitor it at home. And then if you are experiencing a headache that is being unrelieved with medication, if you have any change in vision, any nausea, vomiting, dizziness, lightheadedness, any abdominal pain in that right upper area, it's often described as like indigestion. And then if you're just generally feeling unwell, we would always encourage you to reach out to your obstetrician. That's going to be making sure that you're chatting with your doctor and continuing to go to those prenatal visits. They're going to continue to monitor those vital signs and that blood pressure. It's not really something that can be self-diagnosed at home, but continuing to watch that blood pressure and generally how you're feeling and continuing to stay in communication with your doctor. So in pregnancy, we are going to try to treat that with oral antihypertensive, so oral medications to watch that blood pressure. If it gets high enough, we may do some IV treatments with magnesium, but hopefully we are managing that with some oral medications. So you are at an increased risk for having preeclampsia again, but it's not a guaranteed. So any shortness of breath, wheezing, difficulty breathing, those are all going to be really important that you reach out to a medical professional immediately. But again, we're still looking at that headache being unrelieved with medication, sudden swelling, especially in the hands and the face, any nausea or vomiting. Essentially, if you are having any change in the way that you have been feeling, any sudden change, we would encourage you to reach out to a medical professional immediately. And if you're unable to get a hold of them within a reasonable amount of time, we would send you into the ER.